Good morning, and welcome to Life Science Cares Philadelphia's second webinar interview with the leadership of our nonprofit partners. For those who don't know me, I am Pete Wolf, the Executive Director of Life Science Cares Philadelphia. We decided to hold these webinars in order to highlight how COVID-19 has impacted the vulnerable communities served by our partners, as well as how our partners have responded to the crisis. The webinars also serve as a way for us to stay connected with our nonprofit partners at a time that we can no longer care actively by volunteer. Next slide, please. We are recording the webinars so that our life science colleagues who could not join us today will have an opportunity to watch at a later date. We also encourage you to share the recording with your organizations. This morning, we are fortunate to be joined by our special guests, Michal Smith, who's the Executive Director of Cradles, Crayons Philadelphia, and Milano, the Chief Executive Officer at Idera Pharmaceuticals. Michal will share with us how the COVID-19 pandemic is impacting families with children in our community and how Cradles to Crayons has modified its operations in light of the crisis. You will hear that there remains an urgent need for new diapers, school and art supplies, hygiene items, and other essentials, and we'll touch on how you can help at the end of the presentation. Next slide, please. As many of you know, Life Science Cares was founded in Boston and expanded to Philadelphia at the end of 2019. Our goal is to unite the life science industry in order to improve the lives of our neighbors who are impacted by poverty. We do this through a collective effort to provide human and financial resources to our nonprofit partners. As we got started here in Philadelphia, we held 7 volunteer events, which engaged nearly 80 of our life science colleagues. As the COVID-19 pandemic ended our volunteer opportunities this March, we shifted our focus to providing needed financial support to our partners. Just last month, Life Science Cares made $100,000 in emergency grants that supported our partners' efforts to respond to the COVID-19 crisis. Today, we are actively engaged in additional fundraising efforts that will allow us to make up to an additional $200,000 in grants. At this time, I would like to welcome Milano, Chief Executive Officer of Idera Pharmaceuticals. Vin and the team at Idera are focused on developing revolutionary ways to modulate the immune system so patients can focus on the future. Closer to home, the Idera team is engaged with our community and has been instrumental in bringing Life Science Cares to Philadelphia. Vin?
Thanks, Pete, and good morning, everyone. It's a pleasure to be here and hope everyone is doing well and staying safe. Let me start tell you a little bit about Idera and our commitment in this interesting time we're living in with regards to COVID-19. First, as Pete shared, we're a company focused in on the immune response, particularly working in the field of cancer, specifically advanced metastatic melanoma and advanced colorectal cancer. We're a small company in the suburbs of Philadelphia. We have 36 employees, and although we're not physically able to participate and help out our partner organizations in the city of Philadelphia, we do remain committed to helping them in other ways, in any ways that we can. As we head towards commercialization of our first product, we expect that as our company grows, we will also have the opportunity to become more and more involved with Life Science Cares Philadelphia and our partners. And I would expect that Life Science Cares Philadelphia and the work of our partners will become further part of the fabric of Idera as we grow. As I think about the challenges facing the community in which we live and support in this COVID-19 environment, it very much feels like the industry that we all are part of. We face big challenges, and we face them every day, and we face them with care, with energy, with passion, in order to bring solutions to patients who don't have any. Well, here in this COVID-19 situation, we have a group of people that are suffering from deep poverty and their families, and even worse conditions than they had been before. And the challenge is frankly immediate and more urgent than ever. And it's an honor to be here today with Michal Smith, who's the Executive Director of Cradles to Crayons. And what I've learned about this organization is that there's one similarity, at least, between Cradles to Crayons and Idera, and that is simply that we have a passion for the work that we do that significantly improve the lives of the people that we aim to serve. So thank you for joining us here this morning. Look forward to hearing Michal share her thoughts in this environment. Michal, I'll turn it over to you.
Thank you, Pete, and thank you so much for that wonderful introduction. And passion is absolutely what Cradles to Crayons is about. And we need to have passion because unfortunately, Philadelphia is one of the poorest large cities in America, which we sometimes forget even before COVID. And that means a family of 4 is living on about $11,000 a year. And we have about 146,000 families or children who are living under those circumstances. After food and housing are paid, there's really very little left for other items. So Cradles to Crayons was formed to provide everyday essentials to kids living in poverty. And we thank all of our corporate partners who have been involved with us because we rely on our corporate partners to collect gently used items, clothing, toys, school supplies, books, those everyday essentials that a child needs to thrive. Of the 10 reasons why kids don't go to school, and admittedly we're changing now, but why they're not ready to learn is not having the clothes that give them confidence, not having the school supplies, means that they don't go to school, and if they don't go to school, and sadly they don't learn. And we rely on corporations to supply that product. We also rely on our corporations, our faith-based organizations, our schools and families in the region to come and volunteer to our warehouse. And that's over 2,500 volunteers a month who come here to help us and make custom packs. We work directly with partners who know the name of the child, the age of the child, whether they've got big feet, whether they're reading above or below grade. And those custom packs are supplied to families in need all over the greater Philadelphia region. So that's what we were doing. And so, Vin, we're faced with a challenge right now, as I'm sure you understand.
So Michal, maybe you can share with us, how has COVID-19 impacted the work that you've done, where you've done it, how you've done it? Maybe just share with the group here some color on how your lives have changed since we've been affected by the COVID-19 pandemic.
Yes, it has made it very difficult for our families. Even before, though, our families were hit by COVID, you have to reflect on the fact that many of our families were earning minimum wage. That's $7.25 an hour. And that's in a state where a 1-bedroom apartment requires that you earn at least $15 an hour in order to be able to afford the rent. So these are families who were experiencing difficulty even before COVID hit. And I was shocked by one of the statistics recently that of families earning less than $44,000 a year, over 40% of them have lost their jobs. So that's the population that we are serving. And so now they're at home, they can't work. And so they desperately need not just clothing, but in the same way that they're looking for food, they're looking for help for rental assistance, which actually are provided support through government grants. They're also looking for those essential items they can't afford. They can't buy through SNAP, they can't buy through any other support. And so that's things like diapers, hygiene items, activity packs, those brand new items that they're needing vitally now, which we supplied before, but not in quite such a large volume.
And Michal, how have you shifted Cradles to Crayons operations in light of these needs and increasing needs?
We came to a grinding halt on March the 9th, where we shut the warehouse, our giving factory, and basically couldn't accept volunteers or donated products safely anymore. We couldn't rely on our corporate partners for the normal support that they provide. So we've had to move to new product in bulk. We launched an emergency essentials fund in order to pay for those items, and then we mobilized supply chains throughout the region. The work that we've done with corporations in the past really helped us and has helped us enormously. We connected with Giant, who put us in contact with their supply chain for diapers, because unfortunately when COVID hit, prices for diapers went through the roof, absolutely through the roof. And Giant connected us directly with a supply chain out of Canada so that we could bring over 1 million diapers to Philadelphia, Chicago and Boston too, through leveraging that network. We also found a trucking company based in Camden who brought the diapers down from Canada. And we also then realized that when you're dealing with volume like that, unfortunately, you need materials handling, and Danella, an energy company in the region, supplied all the materials handling. So it truly took a village of our corporate partners to help us do the work. And for every dollar that we raised through our Emergency Essentials Fund, because of those partnerships where everything is supplied free or at deeply discounted rates, we can make every dollar donated go about 4 times as far. And we have now supplied thousands of wipes, thousands of hygiene items. You don't think of the fact that toothpaste can be a vitally needed item at these times. Books, toys, activity items, and a great stack of paper are also another thing that families are looking to keep their kids occupied when they're in a small apartment, perhaps. They don't have any outside space. School is not working necessarily for much more than a couple of hours a day of online learning, and these kids need to be kept occupied. We're starting to look at whether we can safely quarantine clothing so that we can start supplying emergency clothing packs, because not only sadly are families suffering from the effects of COVID, real life catastrophes happen as well. And yesterday we supplied 5 clothing packs to a family who'd experienced a fire, and we could get them out in emergency. I think what's sort of notable is the fact that last year we served 90,000 children. In the past 3 weeks, we've served 15,000 children. If you annualize that, it means that we'll probably look to be serving, or could be serving, if we can sustain it, about 3 times the volume of kids that we served last year. So that's how we pivoted.
Wow. So, you know, we understand from the governor that maybe our part of the state will start to come out of this lockdown situation effectively June 5th. We'll see if that's an optimistic view or not as we head towards that date very soon. But maybe you can share with the team here, the group here, Michael, you know, in the weeks ahead, what might you expect to see happen in the operations, and how might the transition from red to yellow, if you will, affect the organization? And then maybe a little bit longer than that, as we go through the rest of the year here, do you expect things to come back to some semblance of normal? Do you expect to be able to accept more volunteers? How have you and your team thought about the weeks and months ahead?
Yeah, it's such a good question. I mean, I think like everyone, we are researching as far as possible as how not only can we be safe for our team, which we're having to be. I don't think any of us have ever cleaned quite so much in our entire lives, frankly. And so we're looking at following CDC guidelines, state guidelines, and city guidelines as to how we can safely support our team here in the warehouse already. And now we're looking with increased rigor as to how we can do that and possibly accept small numbers of volunteers back at the warehouse, social distancing, masks, lots of cleaning. And we're looking at ways of quarantining product. So another one of our corporate partners has stepped up with a number of storage boxes, and we will have a cycle of probably a few dozen, well, it probably won't be a few dozen to start, but half a dozen storage boxes that we will be using so that people can, at a distance, drop off product. We'll seal it, we'll let it be quarantined for a while, and then we can possibly use it. But again, it's going to be very, very limited operation. And so what we have also done, and I think you can see from one of the slides that's rotating, we've also developed a number of activities that families can do at home. If you go to our website, there are about 9 activities to do with sorting clothing at home, cleaning shoes, making outfit packs for us that we can then use when we start to really mobilize in volume. I think the challenge for us, and I sort of look at it that it's a marathon, it's not a sprint. I think we are looking to a surge later in the year, so that while we may have volunteers for a while, we may be back down to just occupying our lovely new giving factory with our staff rather than our volunteers. And so we know that we're going to have to continue focusing on the acquisition of product cost effectively, mobilizing our supply chain and logistics partners so that we can continue to help kids and families who we know are going to be suffering not just for the short term, but for the long term.
So Michael, can you talk a little bit about what the economic or financial impact is on your organization in order to mount this response?
Well, what we've had to do, I mean, I think we have an unusual fiscal year, and our fiscal year started on April the 1st. So when we closed, had a plan, a beautiful plan in place for FY21 of how we were going to serve children, what we were going to be doing, how we were going to be doing it. And basically we had to throw it completely out of the window, and in a matter of a couple of weeks, completely reforecast, completely redesign what it is, in fact, that we're doing. And so in the past, we relied on recycled product. We relied on the support of the community to provide that donated product, and we relied on donated labor. We had about 25,000 people who came through our doors who provided the labor. And now we have a team of about 12. We have a limited supply, and at the moment, no donated product. And so what we're having to do is shift our entire budget so that we will be buying the larger percentage of the product that we will be serving to kids and not relying so much on the donated stream. So it's a very, very different focus for our model. And through the way that we're planning to do it, we hope to be serving almost as many children, if not more, this year, because we know that demand is still, we're seeing it raise, because at the moment only about 55 of our partners are actually open. When we hit yellow in the next 2 weeks, we know that more of our partners will be open, and then we will have a tsunami of orders. I'm absolutely confident that we will be trying to pivot to provide. So I think the need is so much greater than I think we've even estimated at this point. And the longer it goes on, the more desperate it is for many of our families.
So Michael, as we think about the purpose of Life Science Cares Philadelphia is to care actively, right? And as you know, we just kicked off our efforts here in our great city in December of 2019, and within a very short period of time, the volunteerism part, the actively caring part, grinded to a halt, like everything else did, frankly. But we've rallied cash, financial resources, and made the emergency grants that Pete highlighted in his opening remarks to our partner organizations like Cradles to Crayons. What besides money can we do to help as an industry support what you're doing in this transition period, this viewpoint? Are there any things that you think we should be thinking about doing where we can maybe care actively as opposed to just financially? Or is it just?
Well, I think as you see from the slide that's currently showing that there are a number of ways that you can help at home. As I said, our basic essentials that we provide to kids are clothing packs, our shoes, our arts and school supplies. We will be gearing up a Ready for School program. We're going to call it Ready for Learning because we don't know actually whether kids will be going to school this year, but Ready for Learning, we know they're going to have to learn. there are scavenger hunts to engage kids. We know that even for the short term, having children at home, it's difficult to sometimes find enough for them to do. So we have a number of activities on the website where you can work with your children to collect these items. And then obviously the financial support for those items that we can't get through the donated product stream in sufficient volume, frankly. That 1 million diapers that we purchased only a little while ago, those are all out in the hands of kids, and we know that we're going to have to do that and continue doing that over and over again.
We do have some time for a Q&A. If anybody has questions, please use the Q&A feature of the Zoom app, and we will ask questions of Michael, maybe 1 or 2 questions. But in the interim, Michael, maybe you can talk a little bit about kind of the significance of having access to diapers. You had mentioned, 1 million diapers, and a lot of people think, oh, it's just a diaper. But can you talk a little bit about, to a family that's receiving that assistance, how that really does make an impact in their lives?
Well, there's the basic fact that on average, a family will spend about $80 a month on supplying diapers, so that when you've got a family who's living in deep poverty, trying to make $11,000 stretch for a family of 4, clearly $80 a month is a lot of money to spend. But then there's the psychological impact of not having a diaper. For all of us, if you think about the fact that you have a child, they have a diaper that isn't clean, and you haven't got a diaper to put on that child. It's a health risk. It's also psychologically very emotionally upsetting to a family if you can't change your child. And then the practical fact is that if you haven't got diapers readily available, if childcare is open, you can't leave your child in childcare, so you can't go to work. And so the whole stability of the family suffers. I think a diaper is so much more than just a diaper. It can actually affect the whole economic and psychological state of a family.
So we don't have any questions from the crowd yet. Michael, is there anything else you'd like to share with us before we wrap up?
Well, I'd just like to thank the Life Science Cares community for your support that we have benefited from and have immediately put to good use for families in the region. I'd also like to encourage you. I know volunteering at the moment looks as though it's a long way down in the future, but I would urge you to think about collecting product in your home, think about some of the activities that we've described, and please come back to our Giving Factory warehouse when we open. We will ensure that you're safe. We have invested considerable amounts in keeping our warehouse clean, in following all of the CDC protocols, making sure that you will be safe with us, because I know we're going to need the support of your labor in order to ensure that long-term we continue to provide passionate, engaged support for families in the region. I truly want to thank your community. I want to thank your vision, Peter, for bringing, and Vin, for bringing Life Science Cares to Philadelphia. You are a really great addition to the nonprofit community, and I truly thank you.
Well, we thank you. You and the rest of our partners are the organizations that are doing the hard work in the community, and we look forward to the opportunity, hopefully in the not too distant future, to re-engage through volunteering and caring actively. In the interim, I do encourage everyone to look at the Life Science Cares website for additional activities, which includes the Cradles to Crayons at-home activities. You can start to get a jump on finding materials that would be helpful to the families, as Michael mentioned. And, as I also mentioned earlier, Life Science Cares Philadelphia is actively raising additional funds to enable additional emergency grants. And you or your organization can currently double the impact of your donations to Life Science Cares, as we are in a position to match donations up to our goal of raising an additional $100,000. And these emergency grants will allow our partners, including Cradles to Crayons, to assist the most vulnerable among us in our community. So please reach out to me or Ben if you are interested in donating, or even if you have other ideas about how our life science community could contribute in other ways. I'd like to thank Michael and Vin and everyone who listened to our program, and a special thanks to Idera for their support of this webcast and the support of their employees. Please do follow Life Science Cares on Twitter and LinkedIn for additional news about our next webcast. And thank you for your continued support of Life Science Cares Philadelphia. Have a good day, everyone. Thank you.